that's what most doctors focus on. They hear the alarm, that's your hormone test results, but they never check for the fire beneath it. And what do? They turn off the alarm. They give you synthetic hormones, birth control, medications to suppress your symptoms, but they never ask why the alarm is going off in the first place. Would you ever do that in real life? Would you hear an alarm, take the batteries out and just go back to bed? No, you'd check for the smoke. You'd look for the source. You'd put out the fire. But when it comes to your body, no one's looking for the fire until now. Hormone tests aren't telling you the full story. So you've probably had a test come back as being normal, while still feeling exhausted, bloated, moody, struggling to conceive. That's because the hormones are just messengers. They're reacting to what's happening deeper inside your body. Nutrient deficiencies, inflammation, stress, toxins, they're the fire. So if you only treat numbers on a test, it's like turning off the smoke alarm without ever putting out the fire. So let's talk about what really is going on inside your body. So there's 3 secrets that change everything. Hormone tests are just a snapshot. Doctors treat hormone tests like they're the whole picture, but guess what? Your hormones fluctuate every single day. One blood test in the morning doesn't tell you how hormones shift at night. Doesn't show you what's happening across your entire cycle. And it doesn't tell you why your hormones levels are off. It just shows you the end result. So what's more important is how your body is functioning as a whole. So this leads us into number 2. How many times have you been told that your test results are normal, even though you know deep down something is wrong? You're exhausted no matter how much you sleep. You're gaining weight, even though your diet hasn't changed. Irregular cycles, but your doctor says everything looks fine. Your body's communicating with you long before a test result shows that anything is out of range. And yet traditional medicine ignores this. You don't need a lab result to tell you that something is wrong. You need to understand what your body is really trying to say. So here's number 3. Fix the fire and the alarm turns off on its own. Now, if you focus on fixing hormones, you're just masking symptoms. Instead, you need to look at gut health. If your digestion is off, your body can absorb the nutrients it needs to support balance. Inflammation and stress. Chronic stress tanks your fertility. It depletes hormones like progesterone. Liver and detox pathways. If your body can't process and clear excess hormones, they build up and they cause chaos. So when you fix the root cause, when you fix that flame and you turn it off, and that flame is different for everyone, but when you turn it off, then your body naturally restores balance without needing any synthetic hormones, endless medications. Dr. Lara Bryden, who is a women's health expert, said that hormone imbalance isn't the root problem, it's a symptom of deeper dysfunction. Dr. Anna Kabeka, your body sends signals long before fertility disappears. The problem is most women don't know how to read them. And this is what we're doing. This isn't new. It's just been missed by most medical doctors. Fixing your hormones without fixing whatever is out of balance in your particular gut, liver, and stress response is like mopping up a flooded kitchen without turning off the tap. Dr. Jolene Brighton said that. She's a functional medical expert. Now, doctors don't warn you about this until it's too late or you're getting dangerously close. Fertility clinics push you with extensive treatments, but they ignore this bigger picture. And society tells you just to accept it, but you don't have to. I help women extend their fertility bandwidth naturally before it's too late. So DM me FIRE and I'll show you exactly how to take control now.